This is Jacqueline Gessick, and I'm doing my assessment of the neurologic and the musculoskeletal, which are linked together. So I'll be doing something sort of together at the same time rather than two separate assessments. Frank is my patient that I'll see. Hello, Frank. I'll have you first just walk. I'm noticing his gait. Now can I have you stop right there? Turn around and come back. Stand right here. I'm going to have you do a couple of things. And I'll have you lift one leg up. Balance on that, good. Now the other leg. Okay. And I'm going to have you put your arms out at the side. And can you rotate? See, just getting a range of motion. So with your arm, rotate in the other way. Come in this way. Good. Good. How about your neck? How can you rotate your neck this way? This way. Any discomfort? Any tenderness?
No.
Anything? Great. I'm going to have you bend over and sort of palpate your spine. Good. Any tenderness anywhere?
No.
Good. Okay, I'll have you stand straight up, and I'm going to do something. I'm going to have you close your eyes. I'm going to stand behind you, sort of to guide you, and just stand up for 30 seconds with your eyes closed, with your hands straight at your side. Good. Not wavering or anything. Now, can you put your hands up? You can open your eyes. Put your hands up with your palms this way. Same thing. Close your eyes. No wavering. Good balance. No problems. Okay. I'm going to have you sit down and do a few other tests on you. So the first thing I'm going to do is ask you your name. And
Frank.
And what day it is.
Today's Monday.
And where were you born?
Schenectady, New York.
Okay, I'm going to tell you 3 words, and then I'm going to ask a little later on what those 3 words are. The 3 words are duck, 3, and ladder. Okay?
Okay.
So try to remember those. Okay, so the first thing I'm going to do is I'm going to have you close one of your noses. Any problems, obstructions with your nose?
No.
The first nose is going to be the first test is going to be olfactory, so if you can smell something, so close this nostril if you would with one finger. Can you smell this?
Mm-hmm.
What is it?
Smells like vanilla.
Okay. The other nose? Still smell okay?
Smells like vanilla.
Good. So I'm just going to sort of feel the muscles in your jaw. Can you clench your teeth? Good. Just a little strength there. Good. Clench again. That's temporal here. Good. Can you open your jaw? Good. A little popping shut jaw. Good. Good. The first thing we do is a Snellen test, which would be we'd put the chart there that we've done before to measure your vision to see how you are, and we would measure one left eye bilaterally. So we do the left eye cover at the right eye, and then we do the both eyes. But in the absence of not having a Snellen chart, I'm going to have you do the close vision. So
Okay.
I'm going to have you read this line here, about 14 inches, which is right about there. Can you read this line?
Stereognosis, the mental perception of depth or three-dimensionality by the senses, usually in reference to the ability to perceive the form of solid objects by touch.
Awesome. So that's a full. So the next thing I'm going to do is I'm going to have you cover the same eye as I cover, and then tell me when my fingers come into your field of vision.
Okay.
So cover this eye. This eye.
Coming in. Coming in. Coming in. Coming in.
Okay. Let's try the other eye.
Coming in. Coming in. Coming in. Coming in.
Okay. Good. Awesome. Then I'm going to check for accommodation in your eyes. I'm going to sort of move this pen light in and to see if your eyes will adjust. So I'm going to just sort of cover this eye and measure as the light comes in. And both eyes are dilating. They're equal and both reactive to light. And I'm just going to have you follow my finger. There's no nystagmus, no vibration. Anything double or anything with my
No.
finger moving it?
No.
Good. Next, I'm going to check your sensation, just the physical sensation of touching your face with a piece of cotton. So just tell me if you feel the sensation.
Yes. Yes. Yes.
Good. Now can you look with your eyes that way? Not turning your head, just doing your eyes that way. And he has positive blinking. Symmetry, eyebrows, puffiness, no cheeks. Everything looks symmetrical. There's no puffiness. Can you clench your teeth? Good strength there. Clench them again. Good strength there. Can you push your face against my hand? Good strength. This side too. Good strength. And down. And up against my hand. Against the back of your head. Good. Good. So everything is +5 and all the strength. Next I'm going to do the whisper test and the hearing test. And what this is I'm going to just test it for vibration. I'm going to put it right here on your mastoid bone and tell me when you stop hearing the vibration. And then I'm going to put it by your ear and then tell me again when you stop hearing the vibration, okay?
Okay. Okay.
Okay, so it's double the amount that you would actually hear from the auditory at the auditory canal versus the vibration, so that's just right. I'm going to look inside your mouth for evenness. Stick out your tongue. Say ah. It's totally in the midline, which is awesome. You just lift your tongue up, put it down. Good, good. And I'm going to say a word over here and tell me what I'm saying.
Please move.
Okay.
Baseball.
Good, good. Positive on both the whisper test. And next we're going to check a couple more things with your balance. I'm going to have you stand up again. And I'm going to have you come back over here. We're going to do the sobriety test where you put one foot in front of the other. And yeah, your balance is just putting one foot in front of the other, the heel to toe. Good, good. Now come back over here again so we don't go out of the field of vision of the computer. And we're going to do walk on your heels. Try walking on just your heels. Good. How about your toes? Very good. Now this is good, and next we're going to check some of the other range of motion. Jack and Jessica, I'm continuing my assessment of Frank's musculoskeletal and neurologic assessment. So I'm having him lie down. We're going to check range of motion. So I'm going to have you bring your knee up. So check your hip, move it toward you that way, and back this way, and then out. I'm going to measure adduction, abduction. Good. Now do the other leg as well. Good. Now we're going to do the same thing with the knees. I'll bring your knees up. Okay, do straight up, back, down. I'll push against me for strength. Good. Now we'll do your feet. So I'll have you put your feet down, out, toes down, right, the back one. Against me. Good. Against me this way. Or to do like this. Against me this way. Push back, push back. Good. And I do that bilaterally as well. And then I'm going to check his elbows and wrists the same. So I'll have you bend in and out. Push in to against me. The other way. Good. And your wrist, for your fingers, wiggle your fingers. And do your wrist up, down. Turn your phone this way. Turn it the other way. Okay, push against me. Okay, push against me this way. Again, I will do that bilaterally as well. Next, I'm going to do a pressure test, measuring both, so tell me sharp or dull.
Sharp. Dull.
Okay, I'm going to repeat this up here. How did you feel this?
Dull. Sharp.
from sitting position. And while I'm doing this, I'm checking for heat with vascular laxation. So again, I'm going to just tell me if it's dull or you feel this.
Yeah, I feel it.
Is that dull or sharp?
It's dull.
This is?
Sure.
Okay. So I'm going to have you sit up and I'm going to check your reflexes.
Okay.
So. Good. Patella? I want to just fold you like over, knee over yourself. There you go. Good. I'll do behind your, maybe I'll leave that. Good. The Babinski water. I hate this in the big chair. You do the Babinski water. Okay. Next, I'm going to do test sensitivity in your hand and do you an object and see if you can feel what it is. Can you feel what is the shape of that in your hand?
It's round. It's a coin.
Yep. Next, I'm going to draw a letter inside of your hand, and I want you to tell me if you can identify what the letters I'm drawing.
B.
Okay. That would be the graphisia and the stereognosis that we just identified. And the next thing I'm going to do on your foot, I'm going to see if you can sense the vibration. You feel that?
Yeah.
Cool. This is Jacqueline Gessick. I'm completing my assessment on Frank. And I'm also going to do the two sensations at the same time to see if they're equal. Tell me if the pressure feels the same.
Yes. Yes.
Next, I'm going to check rotation in his hands and his range of motion. So I'm going to have you turn your wrist like this, back against the other way. Open your hand, close your hand. Put your two fingers together and pull against. Good. Push against. Good. Good. Oh, and we did the radial and the ulnar, right? We did the turns and everything for the range of motion. You have full range of motion. Oh, let's put your two hands together like this. And let's try this thing. I'm going to stand behind you. Does it make you dizzy or anything at all?
No.
At all? Okay. Everything was checking out okay. I didn't find any problems. I didn't see any nodules, any irregularities, any inability to have full range of motion. He was +5 on all range of motion. And that concludes our assessment. Oh, one other thing. The 3 words that I told you at the beginning a few minutes ago. Do you remember what they were?
Duck, 3, ladder.
Very good. So also memory and intermediate is in totally intact. So it concludes my assessment.